I feel maybe over the last 10 years there's become, more of an awareness and a recognition of how much the itching caused by cutaneous neurofibromas, so by the skin lumps, can really affect people's lives, and it can drive you absolutely crazy. Lovely. Thank you so much for having me. It's really good to see everyone. So before I jump into pain management, I'm going to quickly touch on itching because this has become something that I feel maybe over the last 10 years there's become, more of an awareness and a recognition of how much the itching caused by cutaneous neurofibromas, so by the skin lumps, can really affect people's lives, and it can drive you absolutely crazy if you can't sleep. And so as part of that, we now have, an itch leaflet. So if anyone wants to look it up, you can Google Guy's Hospital NF1 itch and you'll find our webpage there about it. Because I have had people come and say, I go and speak to a different health professional and they don't believe that my itching is related to my NF. So I say, well, here's our website, all the information about itching. And unfortunately, trying to manage it is quite difficult. So I don't know if anyone, that is something that resonates with you. But some people say to us, I try antihistamines, they don't help. We recommend, that you're moisturizing regularly, simple moisturizer, nothing fancy. But we do have something fancy today. Karen has got us some goodies that I'm going to just show you quickly. Is these dermal ones. So if for any of you where itching is a problem and you would like to try a different form of moisturizer, these will be available at the end of the day, I think. Looking at Karen, yes, great, there we go. And they came onto the scene because unfortunately for those who are on selumetinib, so the drug that Dr. Hirschson mentioned earlier, one of the side effects of that drug is skin breakdown. And so for our children on it, that can be really difficult to manage. So the dermal ones have been prescribed by dermatologists to try and see if that can help, protect the skin and stop it from breaking down. But really intense moisturizer could help with the itching. I'm not saying it will, because like I said, the itch is really difficult to manage. For some people, try everything. Menthol gel for cooling, capsaicin cream, sometimes that heat can help. If you've tried all those things and you're still not getting anywhere, then you can go have a chat with your GP, because sometimes a very low dose of a nerve painkiller, which I'm going to talk about later, sometimes that can help with the itching. Because one of the teams that have been looking into this, they're based in Paris, they're sort of thinking that maybe the itching is actually sitting on a pain pathway, and that's why it's not responding to antihistamines. But, like with all different aspects of NF, there are teams around the world who are working on trying to fix some of the problems that NF causes. And, itching and the skin lumps is definitely, top priority for some of these teams they're working on. So, watch this space. We might have something new for you next time, but at the moment, those are the sort of strategies that we'd use for managing itching. But anyway, on to pain. How exciting. So let's hope I get this the right way like Karen did. If I asked you, if you could live a life without pain, who would go for it? Yeah, if I said a pain-free life, sounds great, doesn't it? But I want you to think about maybe what is the purpose of pain? Like, why do we have pain? Because unfortunately for some people, they don't have physical pain and it causes them a lot of problems. Because, if you think about like when you're growing up and a child and you're trying different things, some things that you tried cause pain. Putting your hand against a hot oven is going to give you a pain sensation. You learn, oh, don't do that again. Or maybe if you're moving your body in a particular way and that causes pain, you can learn, oh, don't do that again. So it's about learning. So there is a very important part of pain. But we look to the professionals who spend all their lives looking at pain to tell us what it is. So the pain is defined by these fancy people as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. So lots of big words to explain. Firstly, pain is unpleasant. It's not something that we want to go through. But why is it happening? Well, it's talking about either actual or potential tissue damage. So again, it's giving signals to our body and our brain to say that something's not right. And sometimes that's because something actually has happened, or sometimes it's because it's something that we're worried is going to happen. And I think the emotional experience is really important as well, because one of our pain doctors gives an example of someone who, came into A&E, he'd stepped on a nail, it had gone through his shoe, and he was screaming the house down, absolute agony, and obviously everyone looking at it going, oh my gosh, this is really bad. Managed to cut the shoe off him, he's screaming, really distressed. But then what had actually happened was that the nail had gone between the toes. It hadn't hurt him at all. But because what his brain saw of this potential pain, believed it to be true, and he was in total agony. And so I think that's a really good example of being like, our brains are trying to protect us, but they don't always have the full picture. And it's that emotions that can go with it as well. So yeah, purpose of pain, like I said, it's there to protect us. It is part of our brain's protective network over our bodies. It's telling us when something's wrong to help us avoid or prevent further tissue injury. So for example, when I broke my ankle and I fell over, had really intense pain, was trying to walk, and obviously the pain was telling me, don't walk on this ankle. And thankfully I didn't. Found out that it was broken, and I had to, be non-weight bearing for quite a while. So it's there telling you, this could get worse. Stop moving. And then long-term experience and the memory of pain helps us to avoid doing those things again. And that can be, physical pain, but also emotional pain. So there are some experiences that we go through that are really unpleasant. And so we might say, well, actually, I'm going to learn from that and not put myself in that situation again. So acute pain. What do we mean when we say acute pain? So like I said, when I broke my ankle, that is an example of acute pain. I've done something that's clearly, a clear accident has happened. Something new very quickly has happened to my body. It was definitely an injury. It was bone fracture. But, if I sprained my ankle, or maybe there was some inflammation in the area. So it's something that's happened very quickly, has a very clear cause. And so that's why we'd call it acute, because it's a very short window of time. The pain is there, telling your body that something is not right. It's that alarm system. And then hopefully, whether it's you've got something in the cast, or, if you've sprained your ankle, you're going to be resting it, putting some ice, elevating it. And hopefully what we would expect is that once the tissue is healed completely, that pain should go away. So that's acute, something has clearly happened. We've, done all the right things to fix it up, and now it has completely healed. And so it needs to be adequately treated to stop it becoming chronic pain. So thinking about maybe some of those examples, you can shout out if you like. Are there any examples that you can think of acute pain that's happened to you or that you're aware of? I've just given one suggestion of twisting an ankle. You can think of any others. No, accidents. Stubbing a toe. Yeah, different accidents that can happen. Kidney stones, so it's clear cause of pain. Exactly. Maybe a headache, you've got something, clear episode of pain. And so for those sorts of things, when that happens, what are the things that you would do to manage them and to make it better? Can you think of any?
Pain relief.
Yeah, pain relief, amazing. What kind of pain relief might we use for acute pain? These are not trick questions. Ibuprofen, paracetamol, yeah, starting the over-counter stuff. Anything a bit stronger? Morphine, yeah. Anything else? Codeine, yeah. That's a great one for back pain, gets dished out a lot. Okay, so yeah, so all of those things. So we're going to take some pain relief. What else might we do? Rest, exactly. You're going to take a break. Put, if it is my ankle, we're going to elevate it. I'm not going to be walking on it. Might want to put some ice on it or a heat pack, depending what the issue is. Yeah, all those sorts of things. So they work really well for acute pain. However, if we are still doing that in 3 months' time, we got a bit of a problem. And that is when we move on to chronic pain. So the sorts of things that we use for acute pain, once it's been going on for a long time, those things that were helpful for a very short term can actually start to be harmful. So with chronic pain, how we usually class that is something that has lasted longer than 3 months and isn't going away. And, it becomes a condition in its own right. So I know, for some of you, you might go see a pain management team, and that is because the pain itself becomes a condition. So whether that is because, you fractured an ankle and it hasn't been set right, or because it's related to NF, whatever the cause is, the pain itself becomes its own condition, if that makes sense. And it's, sometimes, unfortunately, that pain can't be easily explained. So sometimes we know it's because, there is a lump that we can't remove and that is causing pain. And so now we need to manage it. But unfortunately, sometimes it is because, we're not quite sure why the pain's there. It's the pain that we need to manage itself. So some of the examples that I gave before, the paracetamol, ibuprofen, codeine, morphine, long-term use of those types of medications is not very helpful. And unfortunately, long-term use of things like morphine can actually increase your pain receptors and your pain experience increases. So those kind of medications, we tend to, if someone is continuing with chronic pain, we would look for other medications that are better treated for long-term pain conditions. Same with, rest. Rest is great in the short term, but if you're resting for over 3 months, you're going to start to get deconditioned. And we also know deconditioned muscles, once you then try and use them, your pain experience will increase as well, which is why often if you've ever started with a physiotherapist, you might experience that your pain gets worse when you first start working with them. And so we'll get feedback saying, oh no, the physio is not working because it just made my pain worse. And it's like, well, unfortunately, that's because when the muscles are deconditioned, if you start using them, you're going to get an increased pain response. But if you keep going, obviously with your professionals, I'm not saying push through the pain, but if you keep going, you might then start to see that your pain decreases. So things like that. Are there any medications that people can think of that you might have heard of that we use for long-term nerve pain? Gabapentin, my favorites. Amitriptyline. There's one that sounds just like amitriptyline. Nortriptyline, it's getting more popular with GPs. And my triple threat between gabapentin, amitriptyline, and pregabalin. They're kind of the same when I'm talking to people who've had chronic pain. It's like, have you tried this one? Have you tried gabapentin? Have you tried amitriptyline? And we just have to, try and find what works. In the same way with the itching, one size does not fit all. And so, unfortunately, sometimes it is trying to find something that's going to work for you, but also to balance the side effects of these medications. So, unfortunately, some of them can make you feel, very drowsy. You might get a bit of weight gain or dry mouth. So it is trying to find that balance of, benefiting the pain, but also managing the side effects. So in, neurofibromatosis type 1, We know this condition causes tumours to grow on nerves, and sometimes they grow on nerves and grow in parts of the body that we can, easily remove, but unfortunately, sometimes there are lumps in areas that is not safe to remove. And as Dr. Hirschson was saying, the majority of these lumps we don't need to remove. The majority of them are safe to be in your body. But, unfortunately for some people, removing them is out of the question and they cause symptoms. So in that case, that is where we need to think about how can we help you manage in spite of the symptoms that it is causing. And just quickly, which I know Dr. Hirschson touched on as well, if a lump becomes very painful, is growing rapidly, and I mean more like, bigger than a cherry tomato. So tiny lumps we're not too bothered about. Anything bigger than a cherry tomato that is growing rapidly, is changing texture. So things that are soft and squishy, they're the kind of lumps I like to see. Anything that starts becoming as hard as a table, then I would expect you'd want to tell your healthcare professional about it. And then if it's causing any other sort of nerve symptoms, so any like weakness, numbness, pins and needles, anything like that, again, I would recommend escalating to your healthcare professional. So how do we treat chronic pain? And I've already, mentioned to someone today about, that unfortunately, as much as we wish we could, we can't cure chronic pain. We can try and help reduce the pain or the impact that pain has. And so part of, our roles of health professionals is trying to empower people into, managing with that pain, reducing the impact it's having on you, and trying to empower you to get back to as normal life as possible. And so to do that, there is a lot of different tools that we use. So many, many ways to manage. Treatment obviously depends on the intensity of the pain. So, if you've ever been chatting to a health professional about, your pain, I'm sure they will ask you, please, can you rate the pain out of 10? 0 being worst pain, 10 being the worst pain ever, and 0 being no pain at all. So the intensity is going to help that health professional decide what is the best way of treating it. If you have rumbling headaches that sit around a kind of a 3 out of 10 every day, and you go, well, they're really annoying, but I can kind of manage, you probably won't want to start a medication that you need to take every day that's going to give you loads of side effects. That doesn't sound like a great trade. You might say, actually, I'd prefer to think about more like lifestyle methods of, making sure you're eating regularly, drinking lots of water, staying hydrated, sleeping well, all of those sort of more lifestyle things that can help headaches, rather than start taking a medication. Where if you have intensity of pain that is 10 out of 10, you can't get out of bed, then us saying, well, here's the medication that might help, it has all these side effects, you're more likely to say, yeah, that sounds like a really good trade-off from what I'm currently experiencing. So that intensity is really important. And then also what the pain does to your quality of life. Because like I said, with that one, if it's twingy, but you're still able to go to work, do things that you enjoy, then, you're going to say, well, actually, again, we'll try and do more sort of maybe physio or think about lifestyle strategies. But if it's so severe that it is affecting what you want to do, then again, you might think of more treatments to start instead. So the other ways to manage that I'll cover now is self-management, medications, physio, psychology, and surgery. Self-management. So this is one where, you don't need to wait to see a professional. You can access these resources yourself and start thinking about changing the way you approach pain. So some of the resources that we recommend and that are really good, again, you can just Google. There's the Physio Pain Association. They have a list of resources on their website. Pain Toolkit, Flipping Pain, a lot of them is around like pain education. And again, it's more about like management, lifestyle strategies, that sort of thing. And that is free to access for anyone on their website. So again, you don't need a referral. You don't need to be waiting to see a specialist. That is something that you can do today to help with your pain. And medications, as I've already touched on, you know, a lot of the medications we use in NF are nerves pain specific, and they're really different from the medications that you use for acute pain. And again, one of the things when I'm chatting to people about pain and they're maybe trying a different medication is that often people will feed back to me and say, oh, I tried amitriptyline and it didn't work. And I'll go, oh, okay. Talk to me about how you took amitriptyline. And I'll say, well, you know, I'll have a headache and then I'll take some amitriptyline and then it doesn't do anything. And that to me, I'm like, well, yeah, it's not going to work like that, because the acute pain medication, like your paracetamols, ibuprofen, codeine, all of them, they're ones where you're in pain, you take it as a painkiller, and you expect that your pain will get better, usually in about like half an hour. But the types of nerve painkillers, they work completely differently. So the way that they're designed is to be in a certain level in your body at all times to kind of almost dampen down your nerve response. It's kind of like if you've got your dial of your pain up, they're kind of working to just turn that dial down. And the only way they can do that is by being consistently in your body at a certain level at all times. So you taking it once a week or every couple of days, it's just not going to work. They need to be taken every day. And what's also really tricky about them is that often when you start them, your side effects will be worse because your body's like, whoa, what is this? But also you won't get pain relief from it from sometimes like a week, 2 weeks in until you start seeing benefit. And so that could be quite disheartening when you're in pain, you've been started on this medication that makes you feel a bit rubbish, and you're not actually seeing any benefit. So that's why we start these medications at a very low dose, and then you slowly build them up as your body gets used to them. And then we would expect as you increase that you will start to see the benefit. And with these, again, it's about titrating to what works for your body. So for some people, and that has nothing to do with, maybe how big you are, how young you are, anything like that. We could have like big brawly man and he is on the very starting dose of amitriptyline. It's only 10 milligrams. And that is enough for him. It's like, it works. He feels a bit sleepy with them, but he can manage. And then I might have someone who's like very small and tiny, and they're on like 100 milligrams of amitriptyline and it's not doing anything, no side effects, they're totally fine. So we just can't predict it. It is really individual. And that's where it's so important that you have a partnership with your health professional who can help you kind of figure out what's going to work for you. So that's why it's, the medications need to be taken as prescribed and taken regularly. So physio, we in the NF Complex Centre in London, we have a physiotherapist who's actually in our team because we know with the neurofibromas where they're sitting, sometimes that can affect how the nerves are functioning. But also, for some people, they have bone changes like a scoliosis or pseudoarthrosis that's affecting their walking, and that can also end up causing pain. So our physiotherapist works with people who come to our clinic to help with, again, getting full function or as much function as possible back in spite of having these challenges. But again, not everyone needs to come and see an NF physio, musculoskeletal physios in the community, they're great as well. Part of their role is about increasing your muscle strength, because if you are able to stay strong and maximize what you can do, that's going to keep you healthier and stronger for longer. And it's also going to decrease your pain experience throughout your life. And especially for people with NF1 who have, propensity to have slightly softer bones, it's really important that you're doing strength-based exercises to keep your bones strong throughout adulthood. And again, something that I've noticed our physio has been recommending to people is the NHS YouTube. They have loads of Pilates on there, including ones for back pain, ones that you can do in your pajamas. They have pajama Pilates. Me and a group of friends have started doing just their intro to Pilates at home. I offset it by having pastries, so I have Pilates and pastries with my friends to try and do this NHS Pilates, because for me, it's like I heard, that she started recommending that more and more. And I thought, well, if I'm going to recommend this to someone, I want to try it for myself. And what's interesting about it is like they're quite simple movements. I don't know if anyone's tried Pilates, but it was really hard. So that is my own personal journey, is to try and practice what I preach and to try and do this. But yeah, so the NHS YouTube, they have loads of stuff on there, but they've got Pilates, and you can choose to have a pastry with that or not. I'll leave that with you. And then psychology. So psychology is a really important part of our pain management strategy. Often when we mention this to people, sometimes it gets people's backs up a little bit because they're saying, oh, you're saying it's all in my head. Not at all, not at all. The reason why there are pain psychologists is because we recognize having a chronic condition, but especially having chronic pain that is limiting what you can do, and impacting your day-to-day life, is going to affect how you feel about life. Like it's going to, there's a grief there of not being able to do what you used to be able to do. There's loss, there's frustration, there's a lot of different emotions that come with chronic pain. And so that is why, for anyone who is going to a pain service, I would expect that they have access to pain psychologists. And that is why, because chronic conditions are going to affect how you feel about yourself and your outlook on life. And they're there to support you with it. So to address things like fear, anxiety, all that list there, because also how you think will impact how you feel, but it will also impact on what you engage with. So for example, with the physios, if you believe that movement will make your pain worse, then you're not going to move very much. And so you might start working with a physio, but if you have that belief that movement will cause your pain to get worse, then you're not going to do what the physio tells you to do, because you disagree with that. So where a pain psychologist can come in is work with that belief to say, actually, that belief's not helpful. Let's challenge it, and let's see that movement, yes, can be painful, but by working with the physio, eventually you might see improvement. So see how sometimes that belief that we get entrenched in can actually stop you from accessing what will make things better for you in your life. So that's why we talk about psychology. And most of it is based in something called cognitive behavior therapy, but a lot of pain psychologists are also using acceptance and commitment therapy, which I'll get onto in a second. But the reason for that is, I think this diagram does a really good job of showing, is that we are, we're not just bodies, we are emotions, we're our thoughts, we're our feelings, we're our physical sensations, and all of those things interlink. And it would be wild to think that having limitations on your physical body would have no impact on your thoughts or what you do or how you feel about things. They are all interrelated. So for example, if your thoughts are, like I gave before, that movement is going to make your pain worse, then your behavior is going to change. You're going to not move as much. And then your physical sensation, movement is going to become more painful because, you're losing the strength that you do have. And emotionally, you'll probably feel quite low, not being able to do what you wanted to do. So do you see how that they all interact with each other? And that's where having, a team of professionals to help with pain management is so important, because you need that psychologist to help with the thoughts and the emotions. You need a physio or someone to help you with the movement. And then also, maybe it's your GP to help with, taking some pain medication to help with the physical sensation. It's all interrelated. And that's why having, different people coming alongside you to help with your chronic pain is recommended. So psychological strategies, which I mentioned already. So cognitive behavioral therapy, if anyone's used that before, the kind of basis to that is saying, our thoughts impact our behavior, impact our feelings. And so where cognitive behavioral therapy comes in is to target the thoughts. So they say, if we can challenge those thoughts and you can change those thoughts, then that's going to impact your emotions, it's going to impact your behavior. And so, that's really great. It works for a lot of people. Some of those strategies, however, aren't very helpful when you have a chronic condition, which is why a lot of psychologists will use a bit of cognitive behavior therapy, but also a bit of acceptance and commitment therapy. So ACT is maybe a newer kid on the block, if we would say that. And that looks more about saying, okay, you have this condition, challenging the thoughts about your condition is not going to make it go away. You have this condition. So how can we help you accept that you have this and then still pursue the things in life that you value, that are meaningful to you? How can we help you, maximize your life in spite of having chronic pain, in spite of having a condition? What are the things that you really value? So ACT, again, there's a lot of resources online that you can access for free. The creator of acceptance and commitment therapy wrote a book called The Happiness Trap, which is then recommended to anyone on our waiting list for our pain management program. Again, I bought the book and started reading it, and it was really helpful. So it talks about like our thoughts and how we fuse to our thoughts, and ACT sort of helps come up with strategies to defuse and to see thoughts as thoughts rather than as something that is necessarily true. So those are the main sort of psychological strategies that if you saw a pain psychologist, they would use. And deeply embedded into ACT is mindfulness. So is that being present, being fully present in the moment, and how that can help with anxiety, with fear, especially people having panic attacks. Learning mindful strategies can help you be fully present and kind of reduce that anxiety. Is that, my last one. So when you have gone through all those different ways, if pain is continuing to be impacting on your day-to-day life, and you really need just a kind of group intervention in a way, there are pain management programs throughout the country. We're very thankful at Guy's and St Thomas's that we have our input pain management program, but there are pain management programs. We know of one in Bath, there's one up north that I can't remember the name of, and basically it is where you can go, and it's for a very short period of time, so it's 2-3 weeks, where you actually go and stay and get daily input from physio, doctors, pain nurses, pain psychologists, and again, it is about managing pain. So what tools and strategies can we give you to empower you to be able to maximize your life with what you value in spite of the pain? And they, we get really good feedback from them and would recommend. Anyway, those are my resources. If anyone's interested, please take a photo. You're very welcome. And thank you so much for having me. It's been fun. Oh, wait, I just remembered my mindfulness bit. How could I forget? Right. We talked about mindfulness. We've talked about psychology. So now you get a chance to practice. And they used to put me just after lunch. And so everyone's all a bit sleepy already. And then I'd read this mindfulness thing. And we do have one health professional that we're aware of who fell asleep during my mindfulness and needed a sharp kick. Anyway, so mindfulness, for those who haven't practiced it before, if you're not used to it, it can feel a bit weird. That's fine. Just, if your thoughts start trailing off, just come back to your breathing, back to listening to my voice. It's fine if it feels a bit awkward. So what I'd recommend you guys to do is get in a comfortable position, whether that's, both feet on the floor, maybe your hands resting in your laps, hopefully not thinking too much about lunch that will be next. So we're going to give this a go. And what I would recommend is just closing your eyes, not thinking about anyone else, not thinking about, the maybe travel to get here or other things that might be on your mind, but just to be fully present in this moment. Let's do this together. Right. So let's give it a go. The first step is to become aware. So check that you are sitting with a relaxed but upright posture. And for those of you who are standing at the back, you can also do this. The process is definitely easier if you close your eyes. So you can close your eyes if you wish. If you are doing the exercise in a real life situation, you can judge whether to close your eyes or not. That will depend on the situation, but it does help you connect with the experience most fully. Now, bring your attention to your inner experience. Gently bring your awareness to what you are experiencing. Ask yourself, what am I experiencing now? Right at this moment. Gently draw your attention to any thoughts going through your mind. Try to watch and observe these thoughts. For example, you may say something to yourself like, "Oh, I'm aware of anxious thoughts," or whatever the thoughts are for you. Whatever the thoughts are for you, try to accept them as just mental processes. Thoughts that are simply happening without trying to change them or getting hooked into them. Draw your attention to any feelings that you are experiencing. Whatever these feelings are, even if they are unpleasant or uncomfortable. Perhaps saying to yourself something like, "Oh, I'm aware now that I feel sad or angry," or whatever the feeling is for you. Simply try to accept and acknowledge these feelings just as they are, without trying to change them. Now gently draw your attention to any sensations in your body. Scan your body and notice any sensations. Pleasant, unpleasant, any sense of tension or discomfort. Just acknowledge these sensations without trying to change them. Perhaps saying to yourself, "That's interesting. I'm feeling a tightness in my shoulders." Or whatever the sensation is for you. Just acknowledge these sensations without trying to change them. Now gently move your focus to your breathing. Really focus on your breath. The sensations of your breathing. The sensations of the breath from when it enters your nose, when you start to breathe in, until you breathe out. Become aware of your breath traveling through your body. The sensations, the movements of your abdomen and chest. If your mind wanders from the breath, gently bring your attention back to the breath. Use your breath to anchor you in this present moment. Now expand your awareness to include your breath and a sense of your total body, all aspects of it. Notice that it is as if your whole body is being breathed, is breathing softly, gently. If any feelings or sensations of tension or discomfort emerge, imagine your breath moving in and around those sensations, accepting and embracing them, gently exploring them without trying to change them. When their presence becomes less noticeable for you, gently and softly bring your awareness back to your total experience in the present moment, to your body, your thoughts, the environment, and now opening your eyes, sitting here in the present moment. Thank you. Oh, thanks.